Lesko from Arizona for 5 minutes of questions.
Thank you, Mr. Chairman. I have to say, I am absolutely outraged over what I heard today from the witnesses, and I am so sorry for what has gone on. And when we say it was a mistake, that is an understatement. This is awful. And so I want to thank you to the witnesses who are fighting for justice and for change. I, quite frankly, laid the deaths of these thousands of people who died from COVID-19 in New York and other states that required nursing homes to take in COVID-19 infected people at the feet of the state officials who decided that mandate. To show the significance in the difference between what state officials' policies did, let me compare the differences between New York and Arizona, where I live. And Arizona has lots of senior citizens, lots of long-term care facilities. So according to the Atlantic's COVID tracking project, New York had 14,450 deaths across 698 long-term care facilities. That is 21 deaths per facility. Conversely, in Arizona, which has a very large senior population, there were 2,505 COVID deaths across 1,000 long-term care facilities. That's 2.5 deaths per facility. So you compare 21 deaths per facility in New York to 2.5 COVID deaths per facility in Arizona. So that's not a federal problem. That's a state problem. And so we have to ask why. Well, unlike New York, New Jersey, and Pennsylvania, Arizona never required nursing homes to admit COVID-19 patients. That's the difference. That's the problem. And somebody better be held accountable because this pisses me off. You can tell I'm impassioned. But I have a question to Mr. Hammond. Do you think outcomes would have been better in nursing homes if the focus was on those populations rather than telling healthy people not to go to gyms?
I think both were necessary, frankly. I mean, a lot of people died outside of nursing homes too, and as has been said earlier, there's a connection between the rate of spread and in the community and what goes on in nursing homes. And so if your staff and your family members are living in the community, they're going to bring it with them into the nursing home unless precautions are taken.
Ms. Dean, we have already discussed Governor Cuomo's disastrous and fatal policy decisions and the subsequent cover-up. The Department of Justice declined to pursue an investigation into Cuomo or the other states that instituted must-admit orders. Do you believe the Department of Justice has good grounds for an investigation?
100%.
Thank you. Ms. Dean, could you explain why you think the Department of Justice is not investigating?
That's an excellent question. And I think the tentacles are deep and they spread across states and leaders. I think we have to look at the origins of the March 25th order, where it came from, who wrote it. And I think those simple questions can lead us into a direction. But unfortunately, I believe that it involves a lot of people, a lot of money, a lot of hospitals and lobbyists. And I think these issues have been in place for a very long time. And the one thing Vivian said is that the one thing COVID did do is kind of get under the floorboards and show us how much rot there is already. And so don't let our loved ones die in vain. You know, use this tragedy to do good for other families going forward. Yes, it is very curious that there has not been any investigations or subpoenas or a former governor on the stand telling the whole truth and nothing but the truth.
Thank you very much, and I applaud our chairman for bringing up this issue. It's so important, and somebody needs to be held accountable. This is outrageous. And with that, I yield back.